Posterior dislocation in exam shoulder is locked in internal rotation, usually caused by electrical shock or epileptic seizures. Why dislocate posterior is because there are strong internal rotators, that is laterals dorsi, pec major and subscapularis, overpower the short external rotators. Get CT before reduction to check if not locked, because there is a potential to cause a fracture. Reduction decreases flexion, adduction, and axial traction. A Kim lesion is an incomplete avulsion of posterior labrum. A reverse Hell's-like lesion is seen in posterior dislocation, which is anteromedial. Management is McLaurin procedure. You transfer subscapularis tendon with lesser tuberosity into the defect. Immobilize in neutral and abducted to 30 degrees. So therefore, a abductor pillow will be needed. A posterior Bencalt repair or posterior capsule shift is possible. If the reverse Hell's-like lesion is more than 50% of the articular surface, you need to do hemiarthroplasty. Missed dislocation, consider CT scan and referral to shoulder specialist. An inferior capsular dislocation is called Lexutu erectica. There is more chance of axillary nerve and axillary artery injury and thrombosis present in overhead activity in shoulder, in full abduction and elbow inflection.